We're at an interval time after surgery, after the foot surgery, where we did 2 surgeries on your foot. This one that has the ligament repair on the second metatarsal joint, and this is the first metatarsal joint where we did a joint replacement. The physical therapy is doing the range of motion on these toes, and what we're going to look at during this process whenever it's time on these surgeries, is moving and stretching. That's the magic word. We're going to start stretching the joint. On your second metatarsal joint, because the ligament that we repaired is on the bottom of the joint, we actually only want to go in one motion, and that's downward. When we go upward, we're going to stress that ligament that we repaired, and you can tear something and injure something. So really, it's only down on the second toe joint. When we have a bunion or we have arthritis of the big toe joint where we replaced it, we want to go up and down. And this is how that process works. So we'll start with the second toe. And we always want to start at the base of the toe. We don't want to grab the tip of the toe because there are 2 joints up here, all the way up there and all the way down here, that we really didn't do surgery on. And if you're grabbing this part of the toe, you're going to stress these joints and it's going to hurt more. So you really want to grab the base of the toe, and that's all the way where the toe meets the foot, because the joint technically is all the way back here. Okay? So as we do this, we're going to grab the base of the toe, and you're going to anchor your hand, look at where your thumb is, like on the ball of the foot there, like almost like your thumb, and you're going to anchor, and you're going to start, and you relax your foot, relax the tendons, good. And we're going to stretch downward, and we're going to get to the point where there's tension and you feel it. And we relax, and we take a breath, and we do good deep hold, and you hold it for 5 or 10 seconds or so, and then you relax. And you can wiggle the toe a little bit and then stretch it down again. Okay. Now, if this were my left foot, the way I would do this is I would actually cross my legs, and I would grab this with my left hand, and we're gonna put the thumb on the ball of the foot, and like the middle and index finger on the base of the toe. We're not all the way up here again. We're at the base of the toe. We're gonna grab it, and we're gonna stretch it down, and you can see that downward stretch of the joint. And hold it for 5 or 10 seconds, and we breathe into it, and then we relax. And you really want to do these exercises 5 minutes twice a day.
So about like that.
Yeah, and you're gonna I want you to reproduce the pain that I was creating with you. Exactly. You're gonna feel some tension on there. Well, the big toe, the same thing, right? And you're gonna grab the base of the toe. Once again, the big toe is easier because you can really see that joint that we didn't do surgery on up here. You don't want to grab your toenail. You really got to grab the base of the toe. And we're gonna put the thumb on the ball of the foot, and grab the base of the toe and really stretch that down. And you can see that range of motion, and you're starting to stretch that scar tissue out.
Yeah.
Well, and you're gonna reverse it the other way and go up like that for upward. So the big toe, we can always go up and down. And typically if it's the second toe or the lesser toes, you only wanna go down.